Welcome to the deep dive. Today we're tackling a really interesting um, set of conditions in our pets. Myelodysplastic syndromes, MDS for short.
Right.
And maybe think of it less as one specific illness and more like an umbrella term for some tricky blood disorders. We've gathered quite a bit here to really try and understand what's going on sort of under the surface.
Exactly. Yeah, it's not just one thing. MDS covers a whole group of problems, and they all start back in the bone marrow, where the blood cells actually get made.
Okay.
The key issue is usually what we call non-regenerative anemia. So the body just isn't making enough new red blood cells.
Right.
Or you might see other cytopenias shortages of other cells, like white cells or platelets.
And the cells themselves are kind of off.
That's the other piece, yeah. You often see these abnormal-looking developing blood cells.
Yeah.
We call that dysplasia. It's a key feature.
Okay, so bone marrow trouble leads to fewer blood cells, and the ones being made are often, well, wonky. Now, our info splits MDS into two main types, primary and secondary. Primary MDS, as I understand it, it's like the problem starts right there in the bone marrow itself, like a faulty blueprint.
Pretty much. It seems to start with a genetically altered stem cell that just starts multiplying. And what's really interesting, sometimes the bone marrow can actually be packed with cells. We call it hypercellular.
Oh, really? So it's busy in there.
Yeah, but the cells just aren't maturing right. They often die off before they're useful. Like you said, a faulty production line,
Right.
lots of activity, but not enough working product.
Gotcha. And there are subcategories within primary MDS.
There are. You've got MDS with excessive blasts. Those are the really immature cells.
Mm-hmm.
And too many blasts, well, that bumps up the risk of it turning into acute myeloid leukemia, which is a more aggressive cancer.
Right.
Then there's MDS with refractory cytopenia. That means you've got persistent low counts of one or more types of mature blood cells, and it's, resistant to straightforward treatment.
Okay.
And finally, MDS with erythroid predominance, where the red blood cell line is the main one showing those dysplastic abnormal changes.
Okay, so that's primary. What about secondary MDS? That sounds like it's triggered by something else.
Exactly. Secondary MDS is more of a consequence. Those blood cell problems are linked to, well, something else going on in the body. And the list of potential triggers is pretty long.
Yeah, our sources mention quite a few. What are some common ones in dogs?
In dogs, we often see it linked with certain cancers, especially lymphoma and multiple myeloma. Also, exposure to certain drugs or toxins can do it. Immune-mediated diseases are another big category.
Like when the immune system attacks itself?
Precisely. Things like immune-mediated hemolytic anemia or thrombocytopenia. Various infections can be triggers too. And even stuff like ionizing radiation exposure.
And for cats, is there a standout cause?
For cats, definitely LLV, feline leukemia virus. That's a really, really common association with secondary MDS in cats. Something vets are always thinking about.
Good to know. So overall, it seems like dogs might get MDS more often, particularly primary MDS, and often when they're a bit older.
That tends to be the pattern, yeah.
Yeah.
Primary MDS often shows up in older dogs.
So if you're looking at your pet, what kinds of signs might make you think, maybe something's wrong? What should you watch for?
Well, the signs can be pretty vague sometimes, which makes it tricky. You might notice your pet is just more tired than usual, lethargic.
Less energy for walks and stuff?
Exactly. A drop in exercise tolerance. Maybe they seem a bit down, depressed, or they lose their appetite. Sometimes a fever pops up.
Okay.
And because of the anemia, you might actually see pale mucous membranes, like their gums look paler than normal.
Ah, okay.
In some cases, if platelets are low, you might see tiny red or purple spots on the skin. Those are called petechiae. And sometimes the vet might pick up a heart murmur because the heart's working harder.
So a bunch of general signs that mean time for a vet visit.
Definitely. Needs investigation.
Let's dig into those causes a bit more. We mentioned viruses like FLV, FIV, even parvovirus. How do they actually cause this?
Well, these viruses, they often target rapidly dividing cells, and the bone marrow is full of those. So they can directly infect and damage the marrow cells, messing up the whole production process.
Okay.
Plus, the body's immune response to the virus can sometimes cause collateral damage in the marrow, too.
And the link with lymphoma and multiple myeloma, how does that work? Are the cancer cells just crowding things out?
That's part of it, yeah. The
Yeah.
cancerous cells can literally invade the bone marrow space, but they can also release substances like cytokines that interfere with normal blood cell development, that whole hematopoiesis process. So it's kind of a double whammy.
Right. And the autoimmune connection, IMHA and IMTP. You said the immune system is attacking blood cells. How does that lead to MDS?
Well, think about it. The immune system is could have chronically activated and misdirected.
Yeah.
That ongoing inflammation and cell destruction over time might destabilize the bone marrow environment itself,
Hmm.
potentially leading to those dysplastic changes. It's like the whole system gets thrown off balance.
That makes sense. Now, the list of drugs was pretty striking. Chemotherapies make sense, but estrogen, chloramphenicol, even common antibiotics like cephalosporins or trimethoprim sulfa.
Absolutely. Many drugs have the potential to be myelosuppressive. They can dampen down bone marrow activity. For most animals, it's temporary, but in some, maybe due to dose, duration, or just individual sensitivity, it can lead to lasting damage and MDS.
It really shows how sensitive that marrow environment is.
It really is.
What about the nutritional deficiencies? Iron, folic acid? I usually think of those causing simple anemia, just lack of building blocks.
And that's mostly true. Standard iron deficiency anemia isn't MDS. But if the deficiency is really severe and goes on for a long time, the marrow can sometimes start developing abnormal features as it's struggling under stress. It just highlights how fundamental good nutrition is.
And like toxicity, another environmental factor.
Yep. Lead's a known toxin, interferes with lots of enzymes, including ones involved in making hemoglobin and red blood cells. It can directly harm the marrow and contribute to both low production and those dysplastic cell changes.
Okay. And lastly, infections like ehrlichiosis, bacterial sepsis. Seems like severe illness itself can be a trigger.
Yeah, severe systemic infections, especially bacterial ones causing septicemia or endotoxemia, flood the body with inflammatory signals and toxins. These can suppress the marrow directly and sometimes lead to those longer-term MDS-like changes.
Wow. Okay, so many potential paths leading here, which makes diagnosis sound, well, challenging. How do vets figure this out? Ruling things out seems huge.
It really is. The first big step is trying to sort out, is this primary, starting in the marrow, or is it secondary to something else? Because if it's secondary, you absolutely have to find and treat that underlying cause.
Right.
And you also need to differentiate MDS from other things that cause non-regenerative anemia, like anemia of chronic disease, kidney failure, other bone marrow cancers like myeloproliferative or lymphoproliferative diseases, or even scarring in the marrow, myelofibrosis. Lots to consider.
So what are the first tests you'd typically run?
You always start with the basics. A CBC, complete blood count, is crucial. That's where you'll usually see the non-regenerative anemia, maybe low white cells or platelets too. A biochemistry panel gives you organ function info, and urinalysis helps round out the picture. These can sometimes hint at an underlying cause.
But getting more specific, especially for secondary MDS, requires more digging.
Definitely. Depending on the clues from the history and initial tests, you might run specific titers for viruses like FLV or FIV, check iron levels if deficiency is suspected, run tick panels for things like Ehrlichia, or do a Coombs test if you suspect an immune attack on red cells.
And imaging, does that play a role?
It can, yeah, mostly for finding those secondary causes. Like you mentioned, lead and abdominal X-ray might show a swallowed lead object, like a fishing sinker or something.
Oh, right.
And abdominal ultrasound is really useful for looking at organs, searching for tumors, maybe like a retained testicle with a Sertoli cell tumor pumping out estrogen, which we know can suppress the marrow.
But the gold standard, the definitive test, sounds like it's looking directly at the marrow.
Absolutely. A bone marrow aspirate or biopsy is key. That lets us actually see what's going on inside. How cellular is it? Are all the cell lines developing properly? And most importantly, can we see those characteristic dysplastic abnormal cells? That's how you confirm MDS and often helps distinguish primary from secondary.
Okay, diagnosis made, now what? Treatment must really vary.
Hugely. If it's secondary MDS, job number one is treating the underlying problem. Stop the offending drug, treat the infection, manage the immune disease, whatever it is.
Makes sense. What about just helping the animal feel better, like if they're really anemic?
Oh, absolutely. Supportive care is vital. Severe anemia often requires blood transfusions, which can be life-saving in the short term.
And if their white count is dangerously low, neutropenia.
Then infection risk is high. So you need to be careful to limit their exposure to other potentially sick animals. Maybe use broad-spectrum antibiotics prophylactically or to treat infections. Strict hygiene is important too.
Our sources mentioned filgrastim for that.
Yes. Filgrastim, or GCSF. It's a growth factor that specifically stimulates the production of neutrophils, those key infection-fighting white blood cells. It can help boost the count.
And for the anemia itself, beyond transfusions, erythropoietin or darbepoetin.
Right. Those are synthetic versions of the hormone that tells the bone marrow to make red blood cells. Erythropoietin, or EPO, and darbepoetin, which is just a longer-acting version so you give it less often. They can help stimulate red cell production over time.
Okay, but what if it's primary MDS, where the marrow itself is the root problem? That sounds tougher.
It generally is. Treatment for primary MDS is often more about managing symptoms and trying to, well, slow things down. Sometimes chemotherapy drugs are used. The sources list things like hydroxyurea, cytosine arabinoside, prednisone, cyclosporine A, vincristine, drugs that have been tried.
But not a guaranteed fix?
No, unfortunately. The effectiveness varies a lot, and these drugs have their own side effects to consider. It's a complex decision.
And there was that specific mention, interferon alpha for cats with FLV-related MDS?
Yes, interferon alpha can sometimes help modulate the immune system and has shown some benefit in managing FLV and its complications, potentially including MDS in some feline cases.
So whatever treatment path you're on, keeping a close eye on things is essential.
Absolutely critical. Serial monitoring, usually with regular CBCs, is needed to see how the blood counts are responding. Are things getting better, staying the same, getting worse? That guides further decisions.
Which brings us to prognosis. What can you expect? Sounds like it really hinges on that primary versus secondary distinction again.
That's probably the biggest factor, yes. If you can find and successfully treat the cause of secondary MDS, the outlook can actually be pretty good. The marrow might recover completely.
That's hopeful.
It is. But primary MDS, unfortunately, generally carries a more guarded to poor prognosis.
Are there specific things within primary MDS that signal a worse outlook?
Yes. Things like a higher percentage of those immature blast cells in the marrow that suggests it's closer to becoming leukemia. Having multiple cell lines affected, so low reds, whites, and platelets. And just how severely abnormal or atypical the cells look under the microscope. Those tend to be poor prognostic indicators.
This has been, wow, a really thorough look at myelodysplastic syndromes. It's crystal clear this isn't just one disease, it's a whole category.
Definitely a spectrum.
And that split between primary and secondary is just fundamental, isn't it? Highlighting how much detective work goes into finding those underlying causes sometimes.
It really is. You have to look broadly.
And seeing the sheer range of triggers, viruses, cancers, drugs, toxins, even nutritional issues, it's kind of amazing how many different things can knock that delicate bone marrow balance off kilter.
It's a sensitive system.
It really makes you appreciate the body's complexity right down at the cellular level and how disruptions there can show up in so many different ways, posing these, well, significant challenges for our pets' health. Definitely gives you something to think about regarding how interconnected everything is.